you guys.
Perfect. Thank you very much.
Yeah, thank you so much for being here. Now, the CrossFit Health Doc Day, has that happened yet, or when is that coming
No,
up?
it's on the 23rd of May.
Okay, so a few more weeks, huh?
Yeah,
Very exciting. And I'm sure that some of what we're going to talk about today is a little bit of a preview of what may be happening there, correct?
exactly. Yeah, we talk about two topics that we have in talks there in on the conference. And yeah, the specialty of the conference is that we not just have these talks about scientific analysis of CrossFit or the health aspect of CrossFit. We also have a lot of workshops with physiotherapists and so on. So it's a dynamic thing. It's not just a frontal situation where we just talks or something like this. It's also
Yeah.
a dynamic conference.
Everybody knows how much us CrossFitters love to move, so I don't think you could let them sit there an entire day and not get their
Exactly.
hands dirty. Yeah, that's amazing.
So therefore, we
Well,
have discussion corners, for example, where everybody can decide what is interesting for him or her, and yeah, to move a little bit around and to see what everybody is doing.
that's fantastic. Well, I'm still chatting with Keta and trying to see if she can get any audio video there.
Yeah.
I've talked with CrossFit about trying to use their translation services and everything to share it because I think it's going to be such an amazing day. I'm bummed that I can't be there in person. But it's you guys are just leading from the front on the research front in CrossFit, so it's really exciting that you're doing that. And I know it's a ton of work, but for all of us medical professionals in the CrossFit space, I want to say thank you, before we dive in here because it's extremely valuable. And I think having objective evidence to share, with the medical and the training world about the methodology is very important. So thank you very much.
Thank
I
you.
want to take a couple of minutes just to introduce you guys and have you just give one or two lines about yourself and what you do. So I had the chance to get to meet Thomas when we were in Germany, and we did a bit of a health kickoff day in Berlin, and he gave a preliminary presentation on some of the work that he and Annette have been doing. And Annette is a lead researcher as well. And I won't try to pronounce the institute's name. I'll let you guys do that, but you're located in Munich. So if I could just hand it over to you guys for a second and give a little background on yourselves and how you got drawn into this CrossFit world and doing research here.
Hey, then Tom, should I start or? Okay. So yeah, as you already said, my name is Annette Schmidt. I'm a professor of sports biology, and in my research, I focus on the physiological effects of CrossFit and other functional fitness concepts. And I'm particularly interested in the fitness of emergency forces such as special forces or specialized forces, as well as in firefighters and police. So also for our CrossFit concepts, we especially focus on this these persons.
Amazing. Yeah. And certainly around the globe and in the United States, that category, right, of our military personnel and what we call first responders, right? So fire, police, and everyone else has always been an integral part of the community and what we do. So that's amazing that you're doing that research. Thomas, you want to tell us a little bit about yourself?
Yeah, since I work for Annette, I focus on the same topics. And yeah, I was an officer myself in the military for 15 years until 2023. By the end of August, my duty ended. During that time, I worked as a EOD, IED specialist, and then I was able to do my PhD at the University of the Bundeswehr, again at Annette's chair. And yeah, now I'm here. And
Amazing. And here with us today. So it's a real honor to have you guys here. I want to let you jump into your presentation and talk about your work and walk us through, because I think it's very exciting, and the focus of, this is something we talk a lot about in the medical society, is how to bring CrossFit to those people who need it most. And I think your research focusing on integrating it into the workplace and really decreasing the barrier of entry for individuals, to make it accessible is really a lot of the discussion that needs to be happening. Because we know once people get exposed to it and start doing it, it's highly addictive, right? In all the right ways. But oftentimes it's that first step of getting people into the box or into the affiliate or into a group setting where they can actually experience it. So I'm really excited to hear more about this. And without further ado, I will let you guys take over, and I'll try not to chime in and put myself on mute and keep my questions until the end. And we'll go from there. Okay, so I'll hand it over to you.
Yeah, thank you for the introduction. We want to present and talk to you about the health benefits of CrossFit, especially in the context of workplace health promotion, and therefore show and discuss the results of two of our studies. The first being cardiovascular parameters and internal training load in CrossFit, and second, the MedXFit project. So, as you all know, CrossFit includes constant variation, functional movement, and high intensity. And it is intended to be scalable for athletes of different fitness levels, as we can see here on the left in the screen, an athlete and maybe an older person. The training methodology is based on four main principles. The first being training of all metabolic pathways. The next is training of all 10 fitness domains, not only a few. Another one is called the hopper, which includes to be prepared for any physical task, even the unknown and unknowable. Like you would have to be able to do a 1 RM deadlift or 100 pull-ups or maybe a 5K run or a workout merging all these tasks in one single WOD. And lastly, the understanding of sickness, wellness, and fitness being parts of the same continuum, indicating that it's not only about performance, but also health on the other hand. You can imagine this like for the resting heart rate, when you have someone with a resting heart rate of above 100 beats per minute, you would maybe put them in the sector of sickness with 60 to 100 beats per minute, maybe in the area of wellness. And for fit people, you would expect them to have below 60 beats per minute while at rest. However, quite often people have some kind of misconception about CrossFit, thinking it is nothing but some kind of extreme fitness modality for high-level athletes doing complex movements, as you can see here on the right. Highlighting especially the high-intensity aspect of CrossFit, while forgetting that CrossFit is intended to be much more than that, and of course, suitable for everyone. Now, one could say that this is just the understanding of the general, maybe uninformed population, but yeah, then there is science. There are several studies that investigated the physiological and psychological response in various populations doing CrossFit. They analyzed CrossFit benchmark workouts such as Karen, Cindy, Murph, or Fran, which you might all be familiar with, or the feeling doing it and the feeling afterwards. And what they found was, of course, lactate values of 17.5 millimoles during Karen, 14.5 during Cindy, 10 during Murph, 14 again during Fran. High heart rate values like 182 during Cindy, 185 during Murph, or 179 during Fran. And also the perceived exertion on a scale with maximum at 10 of RPE 8 during Cindy or RPE 8.4 during Fran. Studies also reported about injuries and rhabdomyolysis. And what we see here is that the research concentrates especially on the workout of the day. the most intense phase of the training session. And furthermore, in research studies, CrossFit is categorized as an extreme conditioning program or high-intensity functional training. And this could lead to wrong conclusions, since CrossFit training is more than just the workout of the day, as I already mentioned. CrossFit for most recreational athletes consists of full 60-minute sessions, including a functional warm-up, a mobility part, strength and power training, gymnastics, and so on. Nevertheless, no studies regarding the physiological reactions during a full CrossFit session existed. But this knowledge is critical for a comprehensive understanding of the demands and potential adaptations, to safely recommend CrossFit to people with poor health and fitness, to program, monitor, and control training parameters, to avoid overreaching, overuse, or injury, and to provide a scientific foundation for professionals in the health sector and other domains where physical fitness is key. Therefore, we observed 4 different 1-hour CrossFit sessions in 27 athletes. We assessed their heart rate throughout each session, calculated time spent in different intensity zones, and analyzed differences between sessions and experience levels. And as you can see here, those are our 27 athletes participating, with 8 in the beginner stage, determined by an experience level below 6 months, and 19 experienced athletes. Interestingly, there were no differences in age, height, weight, and even training hours per week, but indeed differences in experience, with 4.9 months in the beginner and 20.9 in the experience level. Here you can get an overview of our workouts that we did. They all consisted of a warm-up, an A part, and a B part, whereby the warm-up was quite similar in session 1, 3, and 4, whereby session 2 included more of bodyweight movements. Then for the A part in session 1 and 4, it was more strength-based, whereby in session 2 and 3 we had EMOMs with weightlifting movements. And in the B part, every time it was some kind of high-intensity WOD. Like here, a team workout lumberjack, then an AMRAP, then 3 rounds for time, and fight gone bad. What we saw was that athletes spent 14.1% of the training time at intensities above 91% of heart rate max, 15% between 81 and 90% of heart rate max, 17.5 in the range of 71 to 80%, 22% at 61 to 70% of heart rate max, and most of the time, with 31.4%, they were below 60% of their heart rate max. If we want to get more into detail, you can see here all 4 training sessions. Without explaining everything, you can see there's one thing that already jumps in your eyes, is that you have some kind of peak during the warm-up in every warm-up we did. Then little lower heart rates with some leveling off to the end in the strength or in the A part. And then high values with a fast rise in heart rate at the end of each session, namely during the WOD. The key findings were that heart rate responses were comparable between beginners and experienced athletes. So we did not have a difference in their physiological response, which says that CrossFit workouts are naturally self-regulating. So beginners will just lift less weight or scale their movements, but their relative intensity or perceived intensity also should remain the same, no matter if you're advanced or if you're a beginner. Which brings us to the following conclusion. Beginners can safely train alongside more experienced individuals without feeling left behind or engaging in workouts that exceed their capacity. In terms of workplace health promotion, there are some valuable insights or findings that you can also take from that. You could hypothesize that there is less or no segregation based on fitness levels, meaning that you don't have to conduct separate training sessions for beginners and advanced people or employees. Because this fitness barrier, this is eliminated by CrossFit, enabling diverse groups of employees to train together, possibly fostering cohesion, motivation, and adherence. And also by colleagues of all fitness levels training together, this could lead to less intimidation by things you heard about CrossFit, for example. If you know that maybe the 60-year-old employee you know from the library or something like this also participates in this course. So integration of individuals with different fitness levels into a single training session makes CrossFit an ideal choice for inclusive workplace health initiatives, or as a matter to improve physical activity and decrease physical inactivity in other areas of life. And this is a crucial finding, since physical inactivity is responsible for 6 to 10% of the burden of disease from type 2 diabetes, cancer, coronary heart disease, and will lead to $300 billion in treatment costs in the year 2020 to 2030, and is responsible for up to 5.3 million premature deaths per year. Coming back to workplace health and sedentary time, in Germany, 62% of adults report that they sit for more than 8 hours a day, whereby 37% of the total sitting time is due to work. And this is easy to understand when you consider that 47% of Germans have a predominantly sedentary job. So true to the motto, exercise is medicine, leading organizations such as the World Health Organization and the American College of Sports Medicine provide health promoting exercise recommendation. This includes aerobic work for 150 minutes at moderate intensity, 75 minutes at intensive intensity, or a combination of those two during the week. 2 times of 10 minutes mobility or flexibility training per week. Strength training for all major, or resistance training for all major muscle groups twice a week, as well as coordination promoting or neuromuscularly demanding training, for example, in the form of 2 times 20 minutes of functional training per week. The problem, however, is that although 31 to 53% of adults fulfill the requirements for endurance activities, only 9 to 29% complete sufficient resistance training. But resistance training is particularly essential for living a carefree and independent life into old age. This is because muscle mass and strains steadily decrease with age. Mobility and coordination also decline, and especially when musculoskeletal complaints are added to this, a progressive loss of functional capacity emerges. So that sometimes everyday activities such as climbing stairs, getting dressed, visiting friends or relatives are only possible to a limited extent, which could also have then negative impact on quality of life and well-being. And in the long term, there's a risk of developing a downward spiral of increasing lack of exercise and loss of functional capacity. So in the view of the low level of participation in resistance training and the long periods of sitting, there's a clear need for action. And ideally, you would also have a program where you do not only do resistance training, but endurance training, some coordination, and also mobility training. The workplace health promotion would be a good spot for this because you meet the sedentary people and you could have, if you have a good program, also attack their physical inactivity. However, the effectiveness of workplace health promotion interventions has not yet been sufficiently proven. And despite suitable structures and existing social networks, the workplace health promotion reaches less than 50% of employees, of whom only a very few percentage participate in the long term. This is due to several barriers we have here, like lack of time, lack of skills, already existing health problems, unflexible working hours, and at the same time, the workplace health promotion should not cost too much. It should be scalable for everyone. It should be supported by the management, and it should be motivating, for example. So to summarize, in this area, we have to deal with three core aspects when identifying suitable interventions. They have to increase health and fitness, of course, lead to long-term behavioral change, and are feasible and practical for implementation in the workplace setting. Based on theoretical frameworks and existing research on CrossFit, for example, that I showed you before regarding the cardiovascular parameters, we hypothesized that CrossFit could be a suitable training concept in this regard. And there is already some existing research that says that intervention studies increase maximum strength and strength endurance of 4 to 42% when doing CrossFit. Also improvements in sit and reach test and functional movement screen scores of 15.2 to 15.9 in CrossFit athletes show that or indicate that CrossFit has a mobility enhancing effect. Then there is a low frequency of injuries with just 1.9 to 3.1 injuries in 1,000 hours of CrossFit, although CrossFit has elements of classic sports and sometimes also has some kind of competitive atmosphere or character. Then we have well-being scores here on a scale from 0 to 25 with these WH5 score questionnaire. CrossFitters also range quite high in the spectrum. And from a behavioral psychology perspective, it can be stated that CrossFitters benefit from training motives such as enjoyment, belonging, health, competition, and challenge. And that training also promotes the satisfaction of basic psychological needs and as autonomy, needs such as autonomy, competence, and social integration. However, there's an overall lack of controlled long-term intervention studies. And CrossFit studies explicitly on sedentary, inactive people in the workplace environment just do not exist. So we designed and conducted the MedXFit project. The overarching research question was, is CrossFit an effective long-term measure for promoting the health of inactive sedentary employees? We broke down this big question into three sub-questions, which were to be answered by means of three sub-studies. The first was the intervention period of 6 months during the MedXFit study, where we were especially interested in the question, does CrossFit increase musculoskeletal fitness and well-being? Then over the course of 12 months, we also looked at the behavioral change to answer the question, does CrossFit lead to long-term change in behavior? And we also did a case report to get some insight in how do employees with health problems benefit from CrossFit. So you can see an overview of the MedXFit study. We involved ultimately 91 participants. All of them were employees with a predominantly sedentary job. They did less than the recommended 2 resistance training sessions per week and less than twice mobility training sessions per week. We then divided them into 2 groups, And while the intervention group practiced CrossFit twice a week for 60 minutes over a period of 12 months, the control group was free to use the workplace health offers of our university independently. The participants were measured before the intervention, after 6 months, and after 12 months. Thereby, we took anthropometric data, mobility, maximum strengths, well-being, and assessed back issues. Furthermore, changes in behavior were analyzed by a psychological model, the COM-B model. The subject of the case study was also recruited from the MedXFit study and we followed him for a total of 23 months. In addition to the MedXFit measurements, his resting heart rate and step count, as well as occupational health examinations, were included in the evaluation, and we also did a semi-structured interview based again on the COM-B model. So here we have our participants, 34 in the control and 57 in the intervention group. And as in this other study also, we do not have any difference in terms of gender, age, and BMI, as well as smoking status between the groups. Interestingly, both groups consisted of more female participants than male participants. And to give you an estimation of their BMI, the control group was at 27.3 and the intervention group at 25.4. And they ranged, on average at 37 years and 38 years of age. For mobility, which was our primary outcome, we did the function movement screen. This is made out of 7 exercises you can see up here on the right. And these are rated from 0 to 3, so that you can have a total score of 21 points, with 21 being the best, 0 being the worst score you can achieve. What you can say about this function movement screen is also that a score less than 14 is associated with an increased risk of injury during exercise. And when we look into the graph, here in orange, the control group, and in yellow, the intervention group, both groups started well below this 14-point threshold mark with around 10 to 11 points. But already after 6 months, the intervention group was well beyond these 14 points, on average 14.9, and managed to improve also at a lesser degree, but still improved from month 6 to month 12, whereby we do not have any difference in the control group, leading to great significant differences between the groups, great significant interaction effect. Maximum isometric strength was measured with the back check. You can see this down here. For this device, you can put the participant in. You can also note at what positions all these measurements were done. So you can replicate it from measurement to measurement to measurement. And there with the back check, we did a trunk extension, a trunk flexion. We did a lateral bend to both sides. We did a unilateral hip extension, and we also did upper body press and upper body pull. And looking at the graphs, you see similar graphs like for the function movement screen, with a faster increase during the first 6 months and a slightly less increase over the course of the second 6 months in the intervention group, which also led to great significant interaction effects between groups. In the control group, there was no significant change over the course. We just did not display it here to have not 100 graphs on one slide. Then regarding well-being, I already told that we had this World Health Organization 5 score consisting of 5 questions, which leads us to a scale from 0 to 25. And here we did not see a significant interaction between the groups, although we did see a clear increase within the IG intervention group from start to end of intervention. Yeah, but no significant or statistically significant difference between groups. And then regarding back issues, those were assessed using a questionnaire in which the test subjects provided information on a scale from 0 to 10 on intensity, impairment, and frequency in days per week. And as you can see here, both groups did not show high values of in terms of back issues, but still there was a significant reduction in back issue intensity when comparing the control group with the intervention group. A trend for better back health in the intervention group regarding the impairment, and frequency also decreased significantly when you compare both groups with each other. The test person in the case study started with low fitness and health values at the beginning. He had moderate strength values and only minor back problems, but his mobility was severely restricted, and his ankle joint could only bear limited weight due to a previous ankle fracture. In addition, company medical examinations revealed that he had high blood pressure and was overweight for years. So to give you an estimate, his BMI was 41.3 kilograms per square meter at the beginning of the study. Over the course of the study, he improved in all areas. So after the study, he had no longer had any back problems. His ankle was fully resilient again, and his mobility and strength values also increased, so that after the study, he had the highest strength values of all test subjects. And in addition, his resting heart rate was reduced and his blood pressure normalized for the first time within the past years. And coming back to the BMI, his BMI decreased from 41.3 to 31.9 kilograms per square meter. So he lost a lot of weight. Besides these performance measures or health measures, it was also worth noting that 53% of the intervention group completed the study, and 60% of the dropouts were due to external reasons. So they did not say, do not want to participate anymore, but other reasons than that, like car accidents or becoming pregnant and stuff like this. And on average, the participants completed 79.3 training sessions per participant during the MedicFit study, so during 12 months. Yeah, and we think this is remarkable because the participants already had good sports facilities at our university before the study. Shown here with the red circles, those are all that areas and buildings on our campus that are used solely for sports activities. So we have several gyms, we have a swimming pool, we have outdoor training facilities. You can even go climbing at our university. And as it is a campus university, the sports facilities are easy to reach and can even be used free of charge for 90 minutes during working hours, which is also regularly actively promoted by our university. And yeah, they encourage a positive attitude towards physical activity. Therefore, we assume that the opportunity, like the social factors and the environmental factors, were already very good before the study, and that therefore the low capability and motivation of our participants led to their low physical activity behavior before the study. It can therefore be assumed that positive changes in capability and motivation encourage the behavior to become permanent. There are several points where we could see that, or where we would say this could be the reason, like improvements in capability could be explained on the one hand by measurable changes in fitness and health values, as I outlined before, but also by observed improvements in movement competence. Like before the study, the majority of participants were unable to perform a simple squat correctly. Whereas during the course of the study, they were even able to perform overhead squats or other advanced weightlifting movements. In terms of motivation, the constantly varying physical task allowed the participants to constantly take on new challenges, overcome them, and thereby experience their own competence. We also hypothesized that the scalability contributed to participants rating their perceived competence higher by repeatedly showing them that they can always adapt the training to their current fitness level, which may have had an impact on their sense of autonomy. Motivation may also have benefited from the fact that CrossFit promoted a sense of social inclusion. Like over the course of the intervention, this formerly loose group increasingly developed into a tight-knit community that supported and cheered each other on during training and also made appointments for training sessions. So in summary, we were able to show in this research project that CrossFit is a time-efficient training concept to motivate heterogeneous groups of inactive, sedentary employees to participate in the long term in order to increase their health and fitness. As a result, we recommend that CrossFit should be given greater consideration in the workplace health promotion and other health sectors. Yet, it is important to test the effectiveness of CrossFit in other groups of people in future research projects. It is also of interest to determine the optimal training load depending on fitness and health status, and to investigate the influence of other lifestyle factors. And our conclusion regarding long-term behavioral change should also be verified by future prospective study designs. So thank you for your attention. And if you're interested in other of our projects, you can follow this link to our Instagram, where we outline or have always some present studies we are conducting right now.
Tom, that was amazing, man. I have so many questions. I want to pepper you guys with these to get some feedback. First of all, kudos on what you have accomplished in a beautiful study design. And the layout and the imagery of the presentation was fantastic. The next obvious step for me when we think about trying to engage employers in doing this is actually putting dollar signs to the ramifications of what you're doing, right? And we know that in the United States, these concepts in the workplace of absenteeism and presenteeism, right? And just to define those for people if they don't know, right? So absenteeism, not showing up for work due to an injury or an illness, and that can be back pain, it can be depression, it can be anxiety, it can be burnout, it can be anything, right? And presenteeism is when you're present, but you're not fully productive. So you show up to work, right? But your back is hurting you, so you can't do what you should or need to do. Or you're suffering from depression, so your productivity is suffering. The estimates in the United States alone, each of those components are close to $300 billion a year. And there's some research that shows that both of those combined, just in the United States, are over $1 trillion in lost productivity. So as you start to think about the ramifications just on those two components, not to mention recruitment of employees and retention of employees, actually keeping them in the workplace, which is another huge cost, right? Onboarding and training employees, what have you. For an employer, they can look at this and say, okay, if I integrate this into my company, there's a potential to save $1,000 to $1,500 a year in lost productivity just by having people be more fit. And you talk about the win-win component of this because they're happier, they're more engaged, they communicate better with their coworkers, they stay longer, you aren't having to do training, they're more productive. It's a no-brainer. So my question next would be, have you thought about the next phase of this research and actually looking at productivity in the workplace versus a control and how you would design such a study?
There are some numbers from previous research where they state the return of investment. For every dollar you spend on the intervention, how much do you get back by reduced sickness days and that stuff. We, as many other studies, did not include this yet, but yeah, really giving that price to the hour that would cost the trainer to conduct the study should be measured, then the equipment that you need, the facility that you need. But we are planning a study on people, especially who have some disorders, where we want to assess their work readiness with a questionnaire. This questionnaire will ask for sickness days. They will ask for, okay, have you been to work and did you feel 100% productive to give this productivity level? It's quite extensive questionnaire that we will use there, but we did not start the study. Yeah.
Yep.
And it's especially for people who have some disorders.
Interesting. I was interested in looking at the graphs on mental well-being from the study and how both groups seem to improve. I may have missed it at the beginning. For the control group, was there any sort of intervention with them at all? Or do you think the improved mood and well-being was just by hanging out and being around people who were actually doing exercise?
The control group, we did not say they should do something. They had the free choice to do something. I mean, we have several classes at campus where you can participate, and we just tracked what they did. So we did not say do it. We just said, okay, after 6 months, tell us how much hours of resistance training did you do? How much aerobic training did you do? And then ask for what kind this was. What we saw was that only a minority, or most of them started doing something, but then after 6 months, they already did something else, and after 12 months, they also already did something else, or some did not complete anything. So yeah, the reason for their improvement in the first 6 months, maybe it was due to the influence of the COVID-19 pandemic, where you have differences in well-being depending on the regulations that you have to follow at that moment. So I don't know.
Annette, I want to ask you, since you've been doing this work for some time, if money was no object and you could design any type of study that you wanted to look and kind of take the next step in this area of research, what would be kind of your dream state of putting a very interesting study together?
There's not just one dream. There are a lot of dreams.
Give me your top three.
Top three. Okay. So as you already heard from Tom, we do in the military in the military world. How is the name? So CISM is a military sport community, and we are doing competitions in this in this field, and at the moment when we organize such a competition, we have to rebuild the complete competition area. So we transport 15 tons of stuff, the rig with all the weights and barbells and so on. So, and my special dream is to have a separate competition area, competition field, where we have all the stuff rebuild it for the whole time, so that we don't have to bring it in a depot and bring it out, bring it back. A competition area for the whole year would be a really nice
Yeah,
thing.
no, that's, and Tom and I were talking a little bit about that before we jumped on. So this SISM is and it's happening this weekend. Was that coming up, Tom? Was that right?
On July, in July.
July. Okay.
Yeah,
And essentially it sounds, and correct me if I'm wrong, that it is a competition between different military branches throughout Europe. Is that correct? And you come together
Exactly.
for a functional fitness
Exactly.
competition that's over multiple days. Uh,
Exactly.
and I also heard that Germany has won the last couple of years. Is that correct?
Yeah,
Yeah.
it's correct. So last year we had the European Championship, and the year before we had the World Championship in Germany. So a lot of time we spent with building and building up the competition areas in.
Was there an American team there?
No,
Oh boy.
there was no American team. We had the hope that we get some soldiers from Ramstein, because it's not such a burden to come this long way to Germany. But at the end, it was not possible to come for them.
All right. Well, we're gonna have to look into this. I'm gonna talk to a couple of people because one, us being unrepresented there, I don't for a world championship is not acceptable, and this will give us something else to talk smack about to each other the next time that we meet. So we'll have to change that. That's amazing.
So in July, in July 26th, there is the next World Championship in the Netherlands. So they have the second chance to be part of the
Yes.
competition.
Okay. Fantastic. The other thing,
But
go ahead.
you asked me for my dreams, not concerning a competition area. You asked me for my dreams concerning scientific questions, I think.
Yes.
And so I'm really interested in non-battle injuries. So in the military, a lot of injuries happen during the normal service, and with different kind of functional fitness concepts, I want to reduce. This is a big aim, but I want to reduce these non-battle injuries in the military, because although these kind of injuries are really costly. So and you spend a lot of money in teaching the soldiers, in having really really smart persons with a lot of specialties, a lot of special knowledge. And if you lose them because of a wrong movement or reduced training, then it's extremely expensive. So this is a field I want to open up, especially concerning the research of their movement, because when somebody has a fracture, for example, then there are a lot of theories, a lot of studies that give a ratio how I don't get the word. Also, he has a special ratio to get another fraction in the next 12 years, 12 months, sorry, again. And so this can be analyzed, and you can have a training concept against this second fracture. And this is.
So I think you mean percentage. So the percentage is higher for another injury going forward,
Yes,
correct?
exactly.
Yep.
Exactly. So, and with special training concepts, you can reduce such non-battle injuries. And this is a really interesting field I want to open up also here in Germany.
Yeah, that's amazing. Yeah, it comes back to force preparedness, right? And you invest so much time in the special operators to lose them to injury
Yeah,
is huge, and they're not easily replaced, right? Because there's only so many individuals who are doing that training and have that skill set. So yeah, that's very important.
exactly.
Well, I know your time is extremely valuable, and you've given us so much. So I truly appreciate you going here. Is there anything you guys would like to wrap up with,
I
or?
do. There is one question, if that's
Oh yeah, go
okay.
ahead, Jim.
Yeah, so it was just a clarification. The question asks, participants averaged 80 sessions per year, so less than 2 weeks, 2 per week on average. Just wondering what the standard deviation and or range of sessions attended per week.
So we intended to have them train for twice a week, but yeah, if for 12 months intervention, they will have some time where they are sick and when they are on vacation. So over the course of 12 months, there are weeks where they just do not train at our facility. So therefore, we don't have the expected 52 weeks twice per week, 104 sessions, but less than this. And it was also during their working hours. So although we provided several more sessions for them, like I mean, and the highest was that we provided 15 sessions per week where they could go and pre-register and go there. There's always, during working hours, the problem that if your boss wants something from you now, you will not be able to attend the session. So that's why, yeah, we just reported this number so you have an estimate how much they trained. It was intended to be twice a week, but yeah, during the work, it was not possible because the training was always connected to being at work. So if
Yeah.
you're not working, you cannot participate.
And individuals, Tom, were allowed to do more than twice a week if they could, correct?
Exactly. Yeah.
Yeah.
Yeah,
And
but
each
but
session,
most of them just did twice,
okay.
two sessions per week. So actually, the case report that we presented, I think, of course, he also started with twice a week, and we, especially at the beginning, did not encourage them to train more than twice a week to not overload them. But there were some who were motivated, especially by the second half of the training cycle, the second 6 month, where some of them started to get 3 sessions in
Yeah.
per week. So yeah, there were some, but it was more of a minority who did that.
And was each session an hour, Tom?
Yeah, each session was 1 hour.
Okay. Fantastic. Yeah, and I think our questioner commented that that's actually amazing because it indicates the degree of efficacy, right? That in just 2 sessions a week, right, to have those levels of improvements essentially in all the parameters is quite impressive, right? It's a significant ROI on
Yeah,
that.
if you look at the recommendations of the World Health Organizations or the American College of Sports Medicine, which I presented earlier, and you keep in mind the numbers that I presented regarding the cardiovascular parameters, you can easily see that with 2 sessions, adding up the numbers or the minutes during high intensity or vigorous activity, plus those that you spend in the moderate zone, and that you also do resistance training during that time, mobility training during that time, and all that stuff, neuromuscular demanding training, you see that with just these 2 CrossFit sessions, you can do maybe all of the recommendations just with limited amount of time, which
Amazing.
is especially for the workplace health promotion quite interesting because you want your people to work and let them do health training so that they can possibly work even more and feel better by that. But they should not train 10 hours every week because then they would not work anymore.
Right, right.
Yeah.
Well, I mean, I think that, the work that you guys are doing is highlighting, why, CrossFit essentially can, not necessarily mandatory, but should be a highly encouraged component of the workplace going forward. And there may be a time in the near future, as employers come to realize the ramifications of the benefits of how much of a win-win this is, right? Because there aren't many things that are both beneficial financially, but also beneficial to the human and to the employee to improve their quality of life. And so it really becomes a no-brainer because you get that time invested in fitness return in spades with improved communication, happiness, retention, all of those things. So you guys are putting the objectivity and the numbers to kind of what we inherently know. It's really fantastic to see. I do want to give another shout out for the health day that you guys have coming up at the end of the month. We'll do everything that we can to share that day with folks. I think it's going to be a fantastic day of presentations for CrossFit and the intervention and the workshops that you're doing. It can be an example to really the rest of the world on how we can come together and do similar. So I'm very excited to see how it goes and hear more about the structure and the layout. And I'm sure we'll have you back in the future if you guys are willing to discuss your future research as it comes out to share your work with everyone. So thank you so much for your time. I really appreciate it, Annette and Tom.
Yeah,
Thank you very
thanks
much
for
for your
inviting us.
All right, you guys have a wonderful day.
Thank you. Same to you. Bye.
Bye.
Thanks, everyone. I'm gonna stop the recording.